Gastroesophageal reflux disease, or GERD, is a digestive disorder where stomach acid or contents flow back into the esophagus. This backflow, known as reflux, can cause a range of uncomfortable symptoms. GERD is more than just occasional heartburn, it's a chronic condition that can impact daily life. In this video, we'll explore what GERD is, why it happens, and what you need to know about its diagnosis and management. Let's start by understanding the basics of GERD and how it differs from simple acid reflux. People with GERD often experience a burning sensation in the chest, commonly known as heartburn. Other symptoms include chest discomfort, regurgitation of food or sour liquid, and sometimes difficulty swallowing. These symptoms can be mild or severe, and for some, they occur frequently enough to disrupt daily activities or sleep. Recognizing these symptoms is the first step towards seeking proper evaluation and treatment. GERD develops mainly due to a weakness or dysfunction of the lower esophageal sphincter, a ring of muscle at the junction between the esophagus and stomach. When this sphincter doesn't close properly, stomach acid and contents can flow back into the esophagus, causing irritation and symptoms. Understanding this mechanism helps explain why GERD can be persistent and why certain treatments are necessary. Some patients continue to experience GERD symptoms even after taking acid-reducing medications like proton pump inhibitors. This is known as refractory GERD. In these cases, symptoms may persist due to factors other than acid reflux, such as non-acid reflux or esophageal hypersensitivity. Identifying refractory GERD is important because it requires a different approach to diagnosis and management. Heartburn is the most recognizable symptom of GERD. It feels like a burning pain behind the breastbone, often after eating or when lying down. This sensation is caused by stomach acid irritating the lining of the esophagus. While occasional heartburn is common, frequent episodes may indicate GERD and should be evaluated by a healthcare professional. Regurgitation is another common symptom where food or sour liquid flows back into the mouth. This can leave a sour or bitter taste and may be accompanied by a sensation of fluid moving up the throat. Regurgitation can be uncomfortable and sometimes embarrassing, especially if it happens in public or during sleep. Some GERD patients experience difficulty swallowing, known as dysphagia. This can feel like food is stuck in the chest or throat and may be accompanied by pain. Persistent swallowing problems should always be evaluated, as they can indicate inflammation or other complications in the esophagus. Beyond the classic symptoms, GERD can sometimes cause less obvious issues like chronic cough, hoarseness, or even asthma-like symptoms. These extra esophageal symptoms can make diagnosis challenging, but they are important clues for healthcare providers. If you have persistent cough or throat symptoms, GERD could be a contributing factor. Endoscopy is a key tool for diagnosing GERD. During this procedure, a thin, flexible tube with a camera is inserted through the mouth to examine the esophagus. Endoscopy can detect inflammation, ulcers, or other damage caused by acid reflux. It also helps rule out other conditions that might mimic GERD symptoms. Esophageal manometry measures the muscle function and pressure in the esophagus. This test helps determine if the esophagus is moving food properly and if the lower esophageal sphincter is functioning as it should. Manometry is especially useful in patients with swallowing difficulties or when surgery is being considered. pH monitoring is a test that detects abnormal acid exposure in the esophagus. A small device is placed in the esophagus to measure acid levels over 24 hours. This test is crucial for confirming whether acid reflux is truly present, especially in patients with persistent symptoms despite medication. Esophageal function tests, or EFTs, help confirm whether reflux is truly present and assess how well the esophagus is working. These tests are important for distinguishing GERD from other conditions that can cause similar symptoms. Accurate testing guides the best treatment approach. Lifestyle changes are a cornerstone of GERD management. Avoiding spicy or fatty foods, reducing weight if overweight, and elevating the head of the bed during sleep can all help reduce symptoms. Small, frequent meals and not lying down after eating are also recommended. These simple steps can make a big difference for many patients. Proton pump inhibitors, or PPIs, are the most commonly used medications for GERD. They work by reducing the amount of acid produced in the stomach. Other acid-reducing medications may also be used, depending on the patient's needs. Medication can provide significant relief, but it's important to use them as directed by a healthcare provider. If symptoms persist despite medication, further evaluation is needed. Not all persistent symptoms are caused by acid reflux. Other factors, like non-acid reflux, esophageal hypersensitivity, or even functional disorders, can play a role. Proper diagnosis is essential before considering long-term medication or surgery. For some patients, surgery may be considered if lifestyle changes and medications do not control symptoms. The most common procedure is fundoplication, where the top of the stomach is wrapped around the lower esophagus to strengthen the sphincter. Surgery is usually reserved for selected cases after thorough evaluation. Accurate diagnosis is crucial in managing GERD, especially when symptoms persist. Relying solely on symptoms can lead to unnecessary or ineffective treatments. Diagnostic tests help confirm the presence of reflux and guide the best management strategy, ensuring patients receive appropriate care. GERD can significantly affect a person's quality of life. Persistent symptoms can interfere with eating, sleeping, and social activities. Effective management, including lifestyle changes, medication, and sometimes surgery, can help restore comfort and improve daily functioning. To summarize, GERD is a common digestive disorder caused by reflux of stomach contents into the esophagus. Symptoms include heartburn, regurgitation, and sometimes difficulty swallowing. Diagnosis relies on a combination of symptoms and specialized tests. Treatment involves lifestyle changes, medication, and, in some cases, surgery. Persistent symptoms require careful evaluation to ensure the right diagnosis and management. The key message is that not all persistent reflux symptoms are due to true acid reflux. Proper diagnostic testing is essential before continuing long-term medication or considering surgery. This approach ensures that patients receive the most effective and appropriate treatment for their condition. In conclusion, GERD is a widespread condition that can have a major impact on quality of life. Accurate diagnosis, appropriate medication, lifestyle changes, and careful evaluation of refractory cases are essential for effective management. If you or someone you know is struggling with persistent reflux symptoms, consult a healthcare provider for proper assessment and guidance.